Hi everyone, this is Bosco. I'm a registered nurse and today we want to look at the nursing process. So as nurses, when we interact with our patients, there is a process that we pass through in order to meet their needs. This process has 5 steps. 1. Assessment. 2. Diagnosis. 3. Planning. 4. Implementation. And the last step is evaluation. So as I have said before, we cannot just receive a patient as nurses and then we say, oh, this is the problem you have and let us inject you this medication. No, we pass through a series of steps. So as it is mentioned here, the nursing process is a multi-step approach used by nurses to meet patient needs. And it includes these steps that I have outlined already above. So let us go to the first step, which is assessment. It is the first step in the nursing process, and in this step, what the nurse does is to collect clients' data. This data can be objective or it can be subjective. Objective data is usually measurable and verifiable, e.g., temperature, and many lab values such as electrolytes, such as hemoglobin, and then subjective data is usually what the patient says, e.g., when the patient says, I feel dizzy, I'm not feeling well, okay, all that is subjective because it is what the patient says it is and we cannot verify it, we cannot measure that kind of data. The second step in the nursing process is diagnosis. After we have collected patients' data, we now go to the second step. We make a diagnosis. This diagnosis should be a nursing diagnosis and not a medical diagnosis. However, we can rely on the medical diagnosis to come up with an accurate nursing diagnosis. So, in the second step of the nursing process, diagnosis, we formulate a nursing diagnosis. And I have said that the nursing diagnosis is different from a medical diagnosis. The root statement of a nursing diagnosis is obtained from the NANDA list of nursing diagnoses. We sometimes call this an understatement. So let us see some examples of medical diagnosis and then also look at some examples of nursing diagnoses. For example, we can have medical diagnoses like pneumonia, malaria, hepatitis B, status asthmaticus. These are familiar to you perhaps, but these are not nursing diagnoses. They are medical diagnoses. Nursing diagnoses, on the other hand, would look like the following. And I have said already that they are derived from the NANDA list of diagnoses. I will link I will give you a link so that you can download the NANDA list in the subscription box. So the nursing diagnosis would include the following: impaired airway clearance, impaired gas exchange, fluid volume deficit, acute pain, hyperthermia. All these are nursing diagnoses, but they are not full nursing diagnoses. They are now still in their short state, or they are just NANDA statements. Okay. So, how then do we write a full nursing diagnosis? The full nursing diagnosis has 3 parts. The first part is the NANDA statement. The second part of that diagnosis is the etiology, which is actually the cause of the problem in the NANDA statement. And then the last part of the nursing diagnosis are the signs and symptoms. Okay, so let us look at some examples. If you are given an understatement such as fluid volume deficit, this one you cannot write an understatement on your own, but you have to derive it from the NANDA list of diagnosis. Remember, NANDA means North American Nursing Diagnostic Association. It is the only association that publishes the NANDA statements that are approved. So you cannot write your own statement. So the NANDA statement we have here is fluid volume deficit. And as a nurse, you already know that the patient may lose fluids, perhaps because they are losing blood, they are hemorrhaging, perhaps because they have nausea and vomiting. So the etiology here, we would state one, the cause of fluid volume deficit would be nausea and vomiting. So this becomes the second part of our NANDA diagnosis. And then how would we know that our patient has fluid volume deficit? This would include the signs and symptoms would include reduced skin turgor, sunken eyes, dry lips, and several others, but we shall stop at those three. Therefore, the full nursing diagnosis would be fluid volume deficit related to nausea and vomiting as evidenced by reduced skin turgor, sunken eyes, dry lips. Take note of the joining words here. Fluid volume deficit related to the first statement, fluid volume deficit, is a NANDA statement. Then the second statement, which is the etiology, is joined to the NANDA statement by this word, related to. And then when you want to add the signs and symptoms, you add as evidenced by. Okay, so that's it. The signs and symptoms are the evidence of the problem. Okay, let us look at the second example. Then our NANDA statement here is hyperthermia. And then the etiology is inflammation. We all know that when there is inflammation, which may be local or systemic, there is actually increased temperature, which is sometimes called fever. So the signs and symptoms therefore would be a temperature of 39 degrees centigrade. The skin of the patient will be febrile on touch. And then sometimes in children, when they get high fever, then they may experience what we call febrile convulsions. So that can also be added as a sign and symptom. So the full nursing diagnosis then becomes hyperthermia related to inflammation as evidenced by high temperature of 39 degrees centigrade, febrile skin on touch, and then febrile convulsions. Okay, so this becomes the full nursing diagnosis. Okay, so then let us go to, so far we have finished assessment. Then we talked about diagnosis as the second step of the nursing process. Then we are going to talk about planning. Planning in the nursing process is something really big, it's wide. So when we plan, we first of all formulate goals and outcomes, then we carry out our interventions, then we state the rationale for our interventions. So we make our goals, and then each goal has outcomes, then we state our interventions, and then we state our rationales. But remember, students, all rationales must be scientific. You cannot just state any rationale, but it should sound scientific. And also remember that your goals and outcomes should be SMART. Let us now use the example of the patient with the nursing diagnosis known as hyperthermia. This child comes to us, to you as the nurse, with fever. And then what do? Okay, so the child, your goal will be the child will have no fever in 30 minutes, in 30 minutes time, as evidenced by, okay, so you see your goal is that child to have no fever in 30 minutes. And what will be the evidence that you have achieved your goal? The temperature reading will be within normal range, and then you state the normal range. Do not just say normal range, but state the normal range of temperature. And then the child will also have no convulsions, and then the child will be feeling febrile on touch. So that will be the goal. The goal is stated, and then also the outcomes are stated. So that is the planning phase. Also in planning, we state the interventions. Um, so what the nurse, the interventions means what the nurse is going to do to solve the identified problem or meet a client's need, e.g. administer rectal paracetamol to suppositories start. Okay, so we know that when acetaminophen paracetamol is administered, it reduces the temperature back to the normal level, and that will be an intervention that is appropriate to the patient's need. And then the rationale for administering rectal paracetamol should be a scientific one. It should sound scientific. For example, like you would say, paracetamol is an antipyretic drug that inhibits prostaglandins and brings about pyrexia. Okay. So the last phase of the nursing process is implementation. So, the fourth phase is implementation, and in implementation, the nurse actually carries out an action to meet the patient's need. So this is when nurse Jane administers the two rectal suppositories, and then after administering the rectal suppositories, the nurse has to document that two rectal suppositories administered. In other words, the plan has been implemented. Okay. So the last phase of the nursing process is evaluation. After we have done all that, we come back and evaluate and find out what we did, the plan we executed. Were our goals achieved? Remember, our goals here was that the child would have uh, normal temperature within 30 minutes. So we go back during evaluation and find out, is the temperature now normal? If the temperature is not normal yet, again we have to assess and find out, why is the temperature not normal? Could there be another problem? Is there any data that we missed during assessment? So we again assess, again we plan, we diagnose and plan. Okay, that's why it is called a process. After you finish evaluation, you can again reassess and see if you as a nurse will implement any other action to meet the patient's need. Okay, so that is in brief, that is the nursing process. It is a continuous kind of it's a process actually, which means we are continually assessing, we are continually diagnosing, planning, implementing, and evaluating. And if there is any other problem the patient has, again the process repeats itself. Okay, so that is it in process. Leave your questions and comments below so that I can respond to them. If you have any question, I'll be very glad to answer it. Thank you very much for your attention and have a nice time.